Which of the following non-prescription products is approved by the US Food and Drug Administration, that is US FDA, for treatment of impacted cerumen? Options are olive oil, carbamide peroxide, isopropyl alcohol 95% in anhydrous glycerin, docusate sodium. Answer is option B, that is carbamide peroxide. Carbamide peroxide is the only FDA approved agent for cerumen removal. Olive oil, docusate sodium, and mineral oil are used to remove cerumen but are not FDA approved. Isopropyl alcohol 95% in anhydrous glycerin is FDA approved for water-clogged ears but not cerumen removal. All of the following are true regarding external otitis except which one? Options are initial treatment for external otitis is an oral antibiotic and corticosteroid. Symptoms of external otitis include otic itching, pressure and fullness in the ear, pain and otic discharge. Mechanical trauma to the ear with cotton-tipped applicators can contribute to increased susceptibility to external otitis. External otitis is also referred to as swimmer's ear. So here we need to find out the exception about external otitis. So here the answer is A, that is initial treatment for external otitis is an oral antibiotic and corticosteroid, which is the wrong statement. So let's see the solution, that is external otitis is referred to as swimmer's ear. Although prolonged exposure to moisture is a typical cause of external otitis, mechanical trauma such as the use of cotton-tipped applicators, fingers or sharp objects in the ear may cause the external ear canal to be more susceptible to damage and microorganism infiltration. Patients with external otitis may present with otic itching, a sensation of pressure or fullness in the ear, pain or an otic discharge. Initial treatment is with an otic antibiotic and corticosteroid, not an oral antibiotic. That is why the first statement is wrong, because the initial treatment for external otitis is with an otic antibiotic and a corticosteroid, not an oral antibiotic. Then oral antibiotics are indicated when the infection is unresponsive to otic treatment, the individual is immunocompromised, or a middle ear infection coexist. Which of the following is an appropriate counseling tip for administration of otic drops? Options are pull the earlobe up and back to straighten the ear canal for children, then pull the earlobe down and back to straighten the ear canal for adults, then fill the otic syringe with hot water, then if cotton is used, it should not be left in the ear for longer than 1 hour. So here we need to find out the appropriate counseling tip for administration of otic drop. So the answer is option D. That is, if cotton is used, it should not be left in the ear for longer than 1 hour. The earlobe should be pulled up and back to straighten the canal for adults and down and back to straighten the canal in children. Then only warm water should be used in the otic syringe, as cold or hot water may induce dizziness. If cotton is used in the ear to retain the medication, it must be large enough to remove easily and should not be left in the ear for longer than 1 hour. All of the following are true regarding ophthalmic formulations except which one? Options are vehicles enhance contact time of the ophthalmic product, antioxidants prevent product deterioration, wetting agents reduce surface tension of the lens, tonicity adjusters are used to maintain a pH between 6 and 8. Answer is option D, that is tonicity adjusters are used to maintain a pH between 6 and 8. Buffers are used in ophthalmic preparations to maintain a pH between 6 and 8, not tonicity adjusters. Tonicity adjusters ensure the product is isotonic. Which of the following is also known as pink eye? Options are allergic conjunctivitis, bacterial conjunctivitis, viral conjunctivitis, environmental conjunctivitis. Answer is option C, that is viral conjunctivitis. Viral conjunctivitis is most often attributable to the adenovirus and is more commonly known as pink eye.